How long does a facelift last? Hi, this is Drrodrohrich, RohrichKnosepodcast, helping you become a better and more informed you about plastic surgery and beyond. So let's talk about some facelift finesse. And I always get asked, well, how long will my facelift last? And I think that's an important question, but I think the more important thing is it depends. It depends on who did your facelift, what type of facelift you had done, and how well you take care of your face and your skin, both before and after surgery. And so this is just kind of an overcap or a recap of facelift history. You know, remember, doing the same thing over and over again the same way and expecting different results is called being crazy. So in the years past, people would just do skin lifts or even superficial lifts, and the results were not very rewarding. But once we understood how patients age because we lose fat in our face, that transformed the modern facelift. So you can fill centrally and lift with a deep layer lift on the outer aspect. That way you get a great result that'll improve the normal. But remember, in facelift surgery, we want to make sure we are in the face protection, not witness protection program. And that means we're very careful so we don't get crazy looking results. And I think that's important to understand. So why is this so important? Because in the past, people would think only about skin laxity, but it's really the structural support of the face, the volume loss, and the deep layer loss. That's really what is more important than anything else. And that's why a sign of youthfulness is a full face, and a sign of aging is one that's lost facial fat, especially in the central part of the face, as you can see here. And in fact, I just took a couple of patients, one that's 8 years post-op, from a patient that had no facial fat done to one that had facial fat done, and you can see the dramatic difference in the 8-year post-ops, the pre and the post. It's dramatic. This transformed facelift surgery is the use of understanding how we age by facial fat loss and addition of facial fat to understanding the deep layers of the face. So you're filling the central part and you're lifting the deep layers. That's really important. And understanding that is a cornerstone of modern facial rejuvenation. So it's not just the deep layer facelift, it's the filling of the centrally that gives you an ideal result that looks natural. And my philosophy is don't overdo it. You know, you want to end up with a natural look, and you want to give a patient a great jawline, a great neck contour, and cheeks. And, you know, and I only operate on people that I like and that are nice, and that's why I give them my cell number. You know, my facelift philosophy is that it's all about patient comfort and understanding what the preparation is, the pre and the post-op care. And, you know, I do them all under general. I keep them in our post-operative recovery unit for 2 days called the cloister. And my staff is the same. My routine is reproducible and the same, and I take great care of my patients, and my staff is superb. You wake up with head dressing, and you keep your little drains in place for 2 days. I see you every day, and I'll take your dressing off, and you can shower, my nurses will wash your hair. I see you every 3-4 days. I have you stay in Dallas for 10 to 12 days, longer if you have a laser or a peel. And the key is you want to get up and about, and you want to start looking great by 10 to 14 days. So all of this is comprehensive care. We get you into lymphatics, we shape and contour your face, and we make it look good. We make it seamless. And the way we prepare our patients is we talk to them about what we're doing. You know, if you have a big, full, round face, that procedure is a little different than a square, thin face. And so this is a patient that has a big, full, round face. This patient required a lot of work to reshape and contour her face and neck, and that was done with a mastectomy and deep layer facelift and shaping of her neck. And this type of thing is very powerful because you're shaping the smash, you're recontouring, you're doing all kinds of things to the neck to give you the shape and contour you want. And here she is a couple years after her face and neck lift. You can shape and contour it, It looks fantastic, but this is done with great effort and also with expertise in understanding the facial aging process. Now, in a thinner patient, in a patient that's lost a lot of weight, like this lady that lost 140 pounds, this is the type of patient that really needs to centrally fill their face selectively in the fat compartments with fat and then lift the outer layer. And that's called a lift and fill deep layer facelift. And here she is pre-op with her very square, thin face. And then here we did a SMAS contouring or stacking, shaping, central facial fat augmentation in this area, very powerful technique. And then what we did is we gave her a youthful look that turned back the clock at least 10 years. And I think that's really what you want. And she also had some superficial chemical peels over her forehead and lip areas, and all that really gives her a nice shape and contour, and that's really what you want. And this is a lady that came to see me, and she's 11 years after her lift and fill facelift. She looks fabulous, and she had a deep layer facelift over 11 years ago with selective central facial fat grafting and some laser resurfacing. You can see that she not only is beautiful, but she's taken great care of herself in the ensuing 11 years. And I think that's the most important thing, is you have to have a patient that's a partner with you in making sure she gets great results and keeps great results. And you know, she's 11 years post-op, and yes, she could probably get some more neck contouring. Obviously, she doesn't want to do that now, and so she just came to see me for Botox. And really, she's on skincare, avoids the sun. She does amazing things post-op. And I think this just is a hallmark of what the longevity is of this type of facial surgery, where you're filling centrally and lifting in the outer layer. And this beautiful woman just typifies that. And I think that's really what you want. And here she is in a close-up of her eyes after doing her eyelid surgery, concomitantly with her facelift, which is very commonly done. And here she is in full length, you know, her face and neck and eyes done 11 years post-op. Most patients are shown on the operating room table or a week or a month post-op. This is 11 years post-op. That's the power of this type of facial rejuvenation. 11 years, and I think that's really what you want to see. You know, you want to be able to see a surgeon that can deliver results that are very powerful and that are natural. The key again is to have you make sure you look your best, you look like you, not like someone else. And I think that's really what the goal of facial rejuvenation is today. So know before you go. And so the key in long-term results is careful patient selection, understanding the science of aging, and doing a deeper layer facelift to lift the outer structures that have sagged with aging, and the central facial fat grafting that you've lost. Give them an excellent neck, jawline, and contouring of their cheeks. And then you can be assured that they'll have longevity of their facelift as long as they take good care of themselves and their face, obviously. And these are things like, you know, skin care, retinoids, sun avoidance, vitamin C, all these things that are part of our post-op regimen. So know before you go. Hopefully you found this to be useful on the longevity of facelift surgery. Know before you go. Leave me your thoughts and comments, and until next time, enjoy.